Hello, hello. Happy Saturday to you folks. Thea Luzaryaga, founder of Care Insurance Solutions. So I promised yesterday that I would give you my updates in regards to the NAHU conference that I attended yesterday. NAHU stands for National Association of Health Underwriters. So I am so glad that I was able to go there. And this is also to assure you, my dear current and future clients, that I am a Medicare advocate and hope to be your trusted advisor, which means I don't just enroll you with a plan. I take time to make sure that I am updated and aware of all the legislative laws and the issues that need attention that I can lobby on behalf of you. So here are my favorite points that were discussed yesterday. I have a little cheat sheet because of my COVID brain. So number one is obviously to preserve Medicare and Medicaid. I am a firm believer of that. Number two is COBRA. So I'm not sure if you're aware that COBRA is not treated by Medicare as a credible coverage right now. So what that means for you folks who are perhaps over the age of 65 and transitioning from an employer plan to Medicare, but may not want to go straight to Medicare. You may want to keep COBRA for a little while, maybe for some reasons. One example is maybe you'd like to keep a preferred provider who only accepts COBRA versus Medicare. Well, sadly, right now, it's not a very good avenue to consider because there are penalties involved because of the fact that Medicare does not consider COBRA as a credible coverage. My next favorite is observation status. So a lot of you folks are not aware. Again, Medicare has two original parts, right? There's hospital part A and medical part B. But sometimes if you go to the hospital as you're thinking inpatient, that falls into part A, sometimes when they bill you, they put you in the category of observation status, which means that if you need to transition from being admitted to a hospital and move to a skilled nursing facility for rehab perhaps, Medicare requires that you are an inpatient in a hospital for 3 days. So what NAHU is trying to propose is for Medicare to approve and consider observation status as an inpatient hospital so that it's easier and seamless when it comes to billing. My next favorite are the two actually. So right now, for you folks who have a health savings account, not sure if you're aware, whenever you activate either part A or part B, you're not allowed to have a health savings account, which means neither your employer nor yourself are allowed to contribute. So what NAHU is trying to propose is, of course, to allow you and your employer to continue to contribute, whether you have Medicare Parts A or Part B, especially for those of you who are still actively employed, generally working for a small employer that has under 20 employees. You generally will need to activate Medicare Parts A and Part B. You should be allowed to continue to contribute to your HSA. My last but not the least favorite is the topic about general election periods. So as you're well aware, Medicare has so many election periods, and one of the most important is the general enrollment period. That occurs from January 1st through March 31st, and it's for those of you who have refused Part B without keeping a credible coverage, usually an employer health plan. Maybe you've retired and forgot to activate Medicare. So the only chance you can do that is from January 1st through March 31st, which means Part B, your medical coverage, will not start until July of that same calendar year. So that's not good for some of you folks because you can be without medical coverage for quite a few months. So what NAHU is trying to propose is to keep that enrollment period from January 1st through March 31st, but let Part B be activated right away, the first of the following month. So that's all for now. And if you have any questions, don't hesitate to reach out to me. My name again is Thea Luzuriaga, founder of Medicare Insurance Solutions. Direct line is 864-625-2112. Website is www.medicaretlc.com. You may also visit us on Google or Facebook. The name of my company is Med-I-Care Insurance Solutions LLC. Thanks so much, and you all have a great weekend. Bye.